Let's speak to Eoghan Corry, who's a travel journalist and a regular on the programme. Eoghan, good morning.
Good morning, Jonathan.
Do we have direct flights from China into Dublin at the moment?
No, we used to have 4 direct flights. There was talk of restoring one for this summer. It didn't happen. So really, it's a matter that impacts us in a sideways way. It's going to impact who's going to implement the very complicated issue of boarding someone who doesn't have a PCR test, checking at the gate. Listeners will need no introduction to what happened over the last 2 years. It falls back on the airlines. Our 2 major airlines don't fly that distance, but what really, where it really comes back to then is the hub airports that our large Chinese community do to commute to and from China. There isn't a lot of other traffic at the moment, and the number of flights is about a quarter of what it was pre-COVID, for reasons already alluded to there by Naomi. But people travelling through Paris and Heathrow at the moment will have to already undergo those tests, and Frankfurt will be the major hub airport affected within Europe. We're not sure what happens with the 3 Middle Eastern hubs that a lot of Chinese people use, Abu Dhabi, Doha and Dubai, and also Istanbul, which is a big hub for Ireland. So what the aviation industry is waiting for is a little bit of clarification, first of all, on what's required, what countries are requiring it, and who really is in charge here. Is it the ECDH? Is it Andrea Nonn's office in Stockholm? Or is it the EU Commissioner for Health, or the new group that made the recommendation yesterday? All of this will probably become clearer in the next few days, but it's another headache for the aviation industry, which is not just hugely based in Ireland, but a lot of the executives of major airlines worldwide and the Director General of IATA, the major aviation body in the world, is Willie Walsh at the moment. A lot of Irish people concerned.
Yeah, at the moment, are there any restrictions on anyone coming into this country right now from any of the destinations that do fly here, or you can get a boat from?
There are no international restrictions coming in because we don't have direct flights to some of the countries. And Naomi alluded to the flights in the direction of China, Hong Kong, places like that do have restrictions. But all of that applies through a hub airport. And that's where the action is going to be when we work out what tests are required. It's going to be the airline that will be responsible for delivering people with the correct papers and with the correct test done to an Irish airport, but they will have passed through somewhere else, and that's where the serious questions will be asked.
There is only one mask mandate out there at the moment. I think it's public transport in Spain. So if you're flying to Spain, you probably have to wear a mask on the aircraft. Other than that, there's nothing really that you need to do.
Not on the aircraft, but the one that really impacts, and the Spanish tourism figures from Ireland are going to show about 2 million visits from Ireland to Spain last year when they come out in a day or two. That's the one that impacts most on us. It's always worth remembering, Jonathan, that we still have those COVID certs, that digital COVID certificate on our phone, not really being examined and required, but that could change quickly. And do bring masks with you, because public transport in Spain is a very good example. But if you have to go to a pharmacy in any country in Europe, as you do in Ireland, you will need a mask. So keep those masks. COVID haven't gone away. And the other thing is keep your certs and your documentation, because things could change very quickly. What we see, and yesterday's discussions show it, that politicians are much more enthusiastic about introducing restrictions than the medical authorities are. The ECDH would have issued advice which was quite contrary to what emerged in Brussels yesterday. So as this sort of conversation continues about COVID, certainly worth keeping your documentation up to date and keep that bundle of masks travelling with you. Very important as well, when you're checking in, you are asked, have you any symptoms of COVID? It's a yes or a no answer. If you answer no and the real answer is yes, there could be repercussions should there be an outbreak on the flight. So be absolutely upfront about that. And the last thing that has to be said about travel insurance has never been as important, because the airline will not act as an insurer of last resort. If you have to pull a flight because you've got COVID, you're not going to get your fare back. But that's what travel insurance is for.